So for example, if we need to needle the triceps muscle, the triceps muscle in this situation is going to be divided into two portions. Why? Because if you look for the upper third, the area that I'm pointing using the arrow of the mouse now, this area represents the presence of the radial nerve as a quotient. So this means we need to understand perfectly the surface anatomy around the muscle in order to avoid hitting by mistake a nerve or a lymph node or a vessel or anything else. In this situation, we are going to use a different kind of grasp, which is called pincer grasp. Pincer grasp means I'm going to grasp the muscle and take it away from the body in order to make sure that I am needling completely away from the quotient. So from this situation, I'm going to use my thumb. Once I felt the hypersensitive spot or the top band, I'm going to direct the needle perpendicular towards my finger. With this kind of grasp, I already took the whole soft tissue away from the radial nerve. But if you look for the lower two-third, it's completely safe because at this point, the radial nerve is now rotating medially toward the biceps muscle. So it means you can go with a flat palpation and needle the muscle perpendicular toward the humerus or toward the bone. So it's completely safe and you can use it a perpendicular when it comes to a presence of top band or a myofascial trigger point in the lower two-third of the triceps muscle. Triceps muscle is one of the most important muscles when it comes to overhead activities and throwing progressions with a lot of athletes because it's going to help in applying the explosive powers with the pec minor major and the biceps for an optimum and professional throwing mechanism. One other